If you have a loved one that is nearing the end of life and they are in a facility of some sort, stay tuned. You might learn something that you didn't know. So, hospice is not just for end of life. Hospice is utilized in many different ways. So, the reason I bring this up is because we recently moved my dad into a facility. Well, I've been his caregiver for the past, however many years. And so I am like used to knowing everything about his day in and day out and making sure that I know like what he's intaking, approving any medications, like stuff like that. So I've been kind of a nervous wreck about letting someone else basically take over care for my dad. And here's where hospice comes into place. About 2 weeks before we moved my dad, we had both gotten sick. And if you have experienced any kind of sickness with a person with dementia, it tends to like knock them down a level. And it definitely did with my dad. He was not able to feed himself. He wasn't able to do much of anything. It was crazy. And so his doctor ordered hospice for him. Well, then we moved him into the facility, and hospice is continuing to go there and to check on them and him and give him all the same services as if he was in my house. So now not only do I have a full-time staff that I trust so far, right? Taking care of my dad. Plus I have hospice staff who I trust so far, right? Because I have no reason not to. And I have like double set of eyes on him. And yeah, so if you have a loved one who is kind of nearing end of life or has a debilitating condition, and they are in a nursing home, or even if they're not, but if you need an extra set of eyes on them, don't hesitate to ask your doctor about hospice.